So let's talk about the veterinarian and what they can do for your programs. Veterinarians are horrendously expensive, and so when you invest in a veterinarian and the veterinary supplies and a qualified technician to work with them, you are making a very big investment. You need to make sure that you're getting a good return on your investment, and it can be very natural to assume that the best investment return that you can get is to chain them to the spay-neuter table and not let them out very often except to use the bathroom, or to provide some routine veterinary care for animals in the shelter. But what you're really hiring in addition to that skill, we need to make time that is set aside, that is quality time for the veterinarian to oversee the wellness of the entire shelter and to develop good protocols that are appropriate for that shelter and to train staff, not only their own veterinary care team, but also to be involved with training the animal care team and other parts of the sheltering system. The veterinarian is the professional in your shelter organization who is uniquely and highly skilled and trained in animal health. So the veterinarian should be entrusted to develop good health care programs. It really is not the role of management to dictate health care programs. And this is one reason why veterinarians leave shelters, is because they're being micromanaged by management. It is also important to know that none of us knows everything. This is a new field, shelter medicine, and so we all rely on our colleagues at other facilities. And so there are a number of resources that your veterinarian can leverage to increase their own skill. There is the Association of Shelter Veterinarians, which all veterinarians who are involved in this field, even if they're private practice veterinarians who are just working as volunteers or part-time in shelters, should belong to. We have an incredible listserv that is very, very active, and we share tips and questions all of the time. There's the National Spay-Neuter Response Team, which is the Humane Alliance Spay-Neuter Training Program in Asheville, North Carolina. And if you have any interest in setting up a spay-neuter program in your shelter or training up your staff, both your veterinarian and your technical staff, into efficient, high-volume, high-quality spay-neuter, this is the agency you want to connect with. They're very well funded by ASPCA and PetSmart to be a training resource, and there's just no better place to go learn how to spay in Asheville, North Carolina. It's quite a nice experience. There are the university shelter medicine programs like ours at the University of Florida, which we are happy to be a resource, and then also national shelter programs such as HSUS, ASPCA, and American Humane that offer consultation services and have a lot of written documents and protocols available as well. So there is a rich library of resources available for your shelter program. The veterinarian, as I said, does need to have authority in order to make decisions about animal welfare and animal health in the shelter. On our listserv, we frequently hear complaints about veterinarians who feel like they're not respected by management and allowed to make the decisions that they need to for the animals in their care. And it is important that we also schedule time for that veterinarian to develop protocols and train staff. Also, the veterinarian's time is extremely expensive, and so you want to make sure that they're using all of their time for things that only a veterinarian can do. You don't want them doing a lot of data entry into PetPoint about their spay-neuter program, or going to find animals to be neutered, or pushing pills to animals that need to be treated. They need to be at a higher level and delegate all of that other activity. They do need to, however, have a trained assistant. A good veterinary technician and a certified technician is ideal, because that will really expand the amount of time that that veterinary care team has to devote to animals.